Imagine parking your car under a tree. A single lightweight leaf falls, taps the windshield, and suddenly the car alarm is blaring at full volume. The system is working hard, but it is completely misfiring. That alarm system is a perfect model for how we usually think about human pain. Normally, pain is a critical warning signal designed to protect us from physical danger. If you strike your thumb with a hammer, the system triggers. This is nociceptive pain. It is a properly functioning alarm alerting you to actual tissue damage. Then there is neuropathic pain. The alarm goes off here not because of a hammer, but because the wiring itself is damaged, like a pinched or severed nerve. In both of these traditional models, the pain is easy to trace back to a visible physical defect, either damaged tissue or damaged hardware. In 2017, a third distinct category emerged: nociplastic pain, arising from altered central nervous system processing without tissue or nerve damage. This happens through central sensitization, which makes the central nervous system highly reactive, artificially cranking the gain of normal sensory signals to maximum. One consequence is hyperalgesia, where the system amplifies a mildly painful stimulus, like a small pinch, making it excruciatingly severe. Another is allodynia, where an entirely non-painful stimulus, like the light brush of a feather, triggers a severe red alert pain response in the brain. Central sensitization is the hidden volume knob turning up signals. Nociplastic pain is the condition you experience when the music is stuck playing too loud. Because doctors cannot find a broken bone or severed nerve, a common misconception is that the patient's pain must be purely psychological, or worse, imaginary. But modern neuroimaging proves otherwise. Functional MRI scans show physical evidence of nociplastic pain, revealing altered hyperactive connectivity in specific brain regions, like the default mode network. Because this processing error is happening system-wide, nociplastic pain rarely presents as a single, localized ache in one specific joint. Looking at this clinical diagram, you can see the widespread effects. Nociplastic pain is typically accompanied by a cluster of non-pain symptoms across multiple systems, including multi-site pain, extreme fatigue, brain fog, and hypersensitivity to lights, sounds, and smells. Let's apply this. If patient A has a sprained ankle and patient B has a pinched sciatic nerve, what about patient C, who presents with 6 months of widespread aching, crushing fatigue, and light sensitivity, but has perfectly clear x-rays? Patient C is dealing with nociplastic pain driven by a hyperactive brain network. Diagnosing it requires us to stop looking for local joint problems and start looking at systemic nervous system symptoms. This brings us to a critical problem for treatment. If the central nervous system amplifier is stuck on high, how do traditional painkillers actually perform? Standard anti-inflammatory drugs like ibuprofen are highly ineffective here. They are chemically designed to target localized tissue inflammation, which is completely absent in nociplastic pain. Opioids must also be strictly avoided. They target traditional pain pathways, but fail entirely to correct the underlying network processing error. Instead of trying to numb a non-existent injury, therapy must focus on rewiring and calming the hyperactive central nervous system. This clinical treatment chart details exactly how we do that. We use multimodal strategies to rewire the brain: non-pharmacological therapies like cognitive behavioral therapy, improving sleep hygiene, and increasing physical exercise, often paired with centrally acting medications like SNRIs. To review, we now have 3 distinct paradigms. Nociceptive pain means tissue damage, like a broken bone, requiring us to heal the tissue. Neuropathic pain means nerve damage, like sciatica, requiring nerve treatments. Nociplastic pain means central sensitization, like fibromyalgia, requiring us to retrain the central nervous system. By understanding this nociplastic framework, modern medicine can stop endlessly searching for a phantom local injury and directly treat the dysregulated nervous system itself.